36 million Americans could be brought into the healthcare system as long as the Obama administration gets its way. So good news for some, but our next guest is a doctor and says reform could trigger some serious drawbacks. Dr. Allan Goroll is a professor of medicine at Harvard Medical School and a practicing internist at Massachusetts General Hospital. Welcome, Dr. Goroll. It's great to see you.
Nice to be here.
So how concerned are you that the president's healthcare overhaul could actually worsen a family doctor shortage that already exists?
Well, the message from Massachusetts is that in order for health insurance reform to be sustainable, we have to strengthen primary care. That's the basic take-home message. And the reason for this is that what we're finding is that we have patients who are newly insured, but they find themselves medically homeless. They don't have a person they can go that they can turn to. They don't have a place where they can go that they consider the practice or the home to which they belong.
So what is the best way then to fix the primary care system simultaneously with the start of this universal coverage if it comes to pass?
Well, it's a multidimensional fix, and it has to occur on many levels. The long-term fix is to increase primary care in terms of attracting a whole new generation of medical students and other healthcare professionals who will want to go into the field.
How do you get more doctors? How do you entice them into the field?
Well, we have to fix the practice of primary care. We have to make it something other than what it is today, which is some have described it as a hamster treadmill, where visits are very rapid. There's not time to do the right job. We don't have the tools, and those tools include health information technology and the teams to do the job right. So the net result is that visits are very rushed, patients are unhappy, doctors are unhappy, and our students pick this up and they say, this is not something I want to do.
Dr. Goroll, we have a story on the Bloomberg terminal. It's actually from a couple of days ago, and it says that U.S. data show that there's a medically appropriate target, and that is there should be one doctor for every 2,000 residents. How far off of that target are we?
We're way off. And in fact, there's also another problem. It's the distribution of doctors, not only where they live, but what fields they choose. In most well-functioning healthcare delivery systems, the ratio of primary care to specialists is 1-to-1. We have in the United States 1-to-3.
And why is that?
Because we have a dysfunctional payment system. It overly rewards the performance of very expensive procedures and pays very poorly for time spent with patients in diagnosis, in counseling, in designing a treatment plan, and explanation.
And one of those things, I guess you hear it, it's almost like it's a running joke. Obviously, you'll make more money if you're a plastic surgeon than if you are a primary care physician.
Right, so we get exactly what we pay for, which is we get lots of very expensive procedures, many of which are unnecessary, and we have very short rush visits and little time for basic doctoring. So patients leave their doctor feeling, I didn't have time to give my story and to be understood, and I'm not sure where I am.
I know this is just one part of it. One interesting idea is to forgive doctors school debt as an incentive to bring more physicians into practice. How long could something like that work? Well,
that's one component. That's necessary but not sufficient. Our medical students have debts that look like mortgages.
Oh, sure.
And to give them debt forgiveness will at least pull down one barrier. However, what they're really looking at is this a field where I can make a difference? Is this a field currently where I could do what I came to medical school to do, which is to be somebody's doctor? So the solution, the immediate solution, is we have to fix the practice of primary care and strengthen it. We've underinvested in primary care for decades, and now we're paying the price. And in order to take on the newly insured, we're going to have a strengthened primary care infrastructure in the country.
Dr. Allan Goroll of Harvard joining us, talking about a very serious dilemma that I don't think has been focused on enough during this healthcare debate. Doctor, I hope we can have you back. Thank you so much.
Be a pleasure.